Hi guys, welcome to surgery important topics. Before starting video, let me inform which platform I use for surgery. So surgery I use it from Mist Dr. Vinit Gupta I followed, and so whether it's Marrow, Preparer, and Mist, it doesn't matter. So from all the platforms, the important topics are same. So I'll share which are the topics are important I feel from surgery. So I just share with you guys. So just follow these topics for important for FMG exam. So from trauma surgery, so basic resuscitation is very important, particularly ABCD. If you see ABCD, so A for airway breathing and circulation and disability. So airway breathing, as you guys always know, so for breathing difficulty, if a question was like a patient was difficult to breathe or any like teeth fracture or very difficult to breathing means is like upper respiratory way, so you should go for like tracheostomy. So these are the basic things, so make sure you are strong enough from this topic. So even for circulation also same, so we need to maintain fluid if we get patients from RTA. So you should make sure you all are the strong in this topic. Okay, so particularly from circulation you need to study about the color coding IV cannulas. So for from babies to adult there will be I think 6 colors, like I think orange, green, pink, and yellow, purple, something will be there. So study about that also. And then Glasgow Coma Skill, as you all guys know, Glasgow Coma Skill is very important. And head injury, if you see head injury, particularly epidural hematoma and subdural and subarachnoid, and what else? Subarachnoid and diffuse axonal injury, diffuse axonal injury. These are the important topics from head injury. So don't forget to study. These are the topics from head injury. Okay, so diffuse axonal injury is something quite important. So recent exam papers there are, I mean, lot more questions from diffuse axonal injury. So study about that too. Then abdominal stab injury. So if we study abdominal stab injury from surgery is not that much difficult to study. So these are the easy topics, but from that particularly retroperitoneal abdominal stab injury is very important. For retroperitoneal stab injury, if you see, there will be particularly zone 1 and zone 2, I think this one, and zone 3. So retroperitoneal means you guys all know, right, meaning. So retroperitoneal means backside of our abdomen, so there will be a retroperitoneal organ. So if you study about these topics, you will get to know. So if zone 1, there will be a simple concept only. If zone 1 got injured by stab, so you should make sure you need to dissect all those, I mean every zones in particular area. So for zone 2, zone 3, you don't need to go for all zones while doing surgery. If zone means, we should go for all zones. Okay, so study about that too. Then thermal injury, burning a thermal injury, there will be like first degree, second degree, first, second, and the third and fourth. There will be like four types of degrees. So make sure you from these topics, like how to manage the patients, what type of the degrees will be there. So what type of method we are using for calculate the thermal injury surface area of body. So if adult men will go for Hull sub 9, and for pediatrics I forgot, but there will be like two names for pediatrics too. So study about that too. After studying thermal injury, study about management for thermal injury also. It's like skin graft, there will be like particular name for that. So study whole topic from also thermal injury. There will be like definitely one or two questions from thermal injury. Then force bite and trench foot, these two topics you will be study from this FMT also. So study here or there, no problem. So even you study epidural hematoma, head injury from lot of subjects from medicine and FMT. So make sure from this all important topics from the trauma surgery. I mean, study about from these topics. So then we'll go for pediatric surgery. So before starting pediatric topics, I need to share one thing. So how to solve questions from pediatric surgery topics. So it's very easy to solve from pediatric surgery. So if you see, so the questions will be like when you need to do particular surgery for pediatric, like if you take example for cleft lip, cleft palate, there will be like particular time for cleft lip and cleft palate as well. So you need to make sure the particular month and time, years, so when the symptoms will occur for pediatric age group, so when that will be disappear, when we need to surgery. So you need to know all these things. So these are the this kind of questions asking in FMG. So make sure you're strong enough in these topics too. So yeah, that's it. So if you see pediatric surgery, so cleft lip and cleft palate, it's very important. So from cleft lip, cleft lip and cleft palate. So I'm not sure. So cleft palate lip will be we're doing 3 month. At 3 month we are doing surgery, and cleft palate we are doing at 6 month, I think. So make sure you're strong. These topics too. So in from cleft lip, cleft palate, there will be something causes for medical causes for cleft lip palate will be there, and type of palates also will be there, unilateral and bilateral. Partial or complete. Many things are there from cleft lip palate. So study about that too. So then aesophageal atresia. Aesophageal atresia is very important. So I'll tell you one important question from aesophageal atresia. So there will be like drooling up saliva. I think symptoms will be like in questions. Their symptoms will be like drooling up saliva in within a few hours after birth, and if you try to give endotracheal tube. So this is imagine about this is the esophagus. So if you give endotracheal tube, there will be like coiled or spring, I think. I'm not sure the term. So coiled or spring, if we take x-ray of this thing, this esophagus while doing endotracheal tube, there will be like in image we are seeing coiling of spring. So with these symptoms and radical image, we can directly go for esophageal atresia. So study about this particular topic from esophageal atresia. Then duodenal atresia. So as you all guys know, duodenal atresia, there will be like a double bubble. Duodenal atresia will be like, I think, one bubble only, right? So no, double bubble. So a double bubble will be there, and not only duodenal atresia, study about other things also like jejunal atresia. So recently June paper, June 2024, they asked jejunal atresia, jejunal atresia. So jejunal atresia means what? Three bubbles, I think, three bubbles. So study about this bubble things from pedia also. Then congenital hyperpylori stenosis. This is something very important from pedia. This is like a 10-star question. So study about congenital hyperpylori stenosis. There will be like cases will be like olive shaped lump. Peritalosis, food peritalosis will going from left right, some electrical imbalance. Baby will be like metabolic acidosis or alkalosis. There will be pararegular aciduria. So many things from congenital hyperpylori stenosis will be there. So study about that too. Even for surgery also, I think Ramstead surgery, I think. So study, detailing from in this topic. Then biliary tree. If we see by biliary tree, there will be like biliary atresia and chorionic cyst. So these are the two different topics. So I made it together, so for easy understanding. So biliary atresia. If you see biliary atresia, there will be like types will be there: covered by late and right hepatic, left hepatic. There are many things are there. Three types only there, and not many things. So three types are there, and the investigation size. So for biliary atresia, there is only investigation will be there for that name is what, Rita scan. It does scan is investigation choice and treatment. How we are doing treatment for biliary atresia. These are the basics and important things from pedia. Then choledochal cyst. Choledochal cyst, there that is having something five types I think. So maybe study about treatment also. Then Kalaskin's tumor. Kalaskin's tumor is nothing but so. Particularly if you imagine this is the biliary tree, this is like a common hepatic duct, this is known as cystic duct, this is known as common bile duct. So these are the particular places most common place to get cancer from biliary tree. So that is called Kalaskin's tumor places. So know about these things too. This is something quite important from pedia topics. So then intersusception, everybody knows about intersusception. Intersusception is also very important. Then intersusception when it will occur. So as I said it before starting pedia topics. So type when does it occur and clinical feature and radiological finding. So as you guys all know, so radiological finding is very important from intersusception. So for ultrasound we having donor signs. For CT CT we having sausage and allelum, not allelum, sausage and something will be there. For anemia we having coil spring signs. Many things are there. So study about treatment also from intersusception. Intersusception is something important 5-star question. So then polycystic kidney disease. Polycystic kidney is very important from PD and adult also. So study about autosomal recessive. If autosomal recessive, there will be like more severe, right? More severe. If autosomal dominant, quite severe, but more common autosomal domination will be. So study about this also from polycystic kidney. There is radiological imaging. I think I forgot spider leg appearance. I think spider leg appearance from radiology image. So know about that things also. Then horseshoe kidney, definitely horseshoe kidney also very important. Recently many questions from horseshoe kidney. I think July paper also we got horseshoe kidney. So study about horseshoe kidney also. So then Meckel's diverticulum. Meckel's diverticulum is something 10-star question again. So after congenital hypertrophy pylorus, Meckel's diverticulum is something very important from pedia. So then like particularly from Meckel's diverticulum, there will be like Meckel's diverticulum scan for the only one I like. For Meckel's diverticulum there will be like a different name for investigation. I mean radiological investigation, that is called technetium pyrotechnate. Technetium pyrotechnate. That scan will be there for Meckel's diverticulum. Study about that things too. So many of you will be forgot to study these things. So only I mentioned this note to study particular technetium pyrotechnate from Meckel's diverticulum. Then Hirschsprung disease. Hirschsprung disease, as you guys know, like from sigmoid colon and rectal, there will be like absence of acetylcholine cells. I think ganglion cells or acetylcholine cells, there will be absent. So because of that there will be no peristalsis. I mean there is no movement, nothing, no movement at all. So there will be like for after born new baby, there like the baby like a minimum time to get fecal delivery from a newborn baby will be like 48 hours. 24 ideally, for 48 hours is maximum time for newborn baby. So if more than 48 hours we need to go for radiological image, right? So if you see radiological image, there will be like no ganglion cells, there will be no dilation in distal part of the colon. So because of that food will be staying intestine. So because of that baby abdomen will become enlarged. So these are the cases from Hirschsprung disease. So make sure you know these things also. So same like from adults also. Hirschsprung disease causes and acalsia cardia, as you all know, from adult acalsia cardia. So these both are the same concept. So make sure, do compare and study this together. Then dilation of renal pelvics. Duplication of the renal pelvics. Duplication of renal pelvics also something important. So I think drooping lily signs will be seen here. See this topic. So study up that also. Then urethral. So study about urethral also. Then undescent testis. Undescent testis something 10-star question again. So I said 3 topics from pedia 10-star questions. So congenital hypertrophy pylorus stenosis and Then what I think mucus diverticulum, then anticentesis. These three topics are very important from pediatric topics. I mean pediatric surgery. Then adult surgery. If we see adult surgery, uh, Zinkus diverticulum is something important. Zinkus diverticulum you will study in ENT also. So Zinkus diverticulum is something important. Particularly the name of surgery from Zinkus diverticulum. Okay. Then occult again I told you before. So occult also is something important. Something important. Then GRD also important. GRD from particular GRD you need to know how to monitor pH pH monitorization from GRD. So they're asking questions from pH monitoring. I mean GRD from GRD topics. Then Borrow syndrome we have another name also. So many guys will don't know about this thing. So study about other names from surgery. So that is very important. So they'll confuse with other names, so that is very important. So barotrauma also known as the Borau syndrome. uh, Bora syndrome and some other two topics also will be there, same concept. So do comparison with that and study these three together at once. So you will not forget any time. So like example, Bora syndrome and malarial tear and esophageal varices. These three are 10-star questions from I mean surgery, adult surgery. So without these three question, I mean from these three, one question will be there, definitely will be there in exam FMG exam. So study about this dose. Then chronic gastritis there will be type A and type A and B. Okay, type A and type B will be there. So it's a very easy concept from gastritis. So study this also. So something important. Okay, then peptic ulcer something very important. Study about whole thing from peptic ulcer topic. So don't lose anything from peptic ulcer topic. This is very important. So then gallstone is very important from adult surgery. Then pancreatitis is very something. This is also very important in star question. So particularly acute and chronic pancreatitis. If you see acute pancreatitis, there will be like something image based question also will be there. So like Cullen signs or Turner sign will be there. Cullen sign is called around the umbilicus. There will be like bruise will be there. Cullen signs will be like lateral side of the lumbar region. There will be like bruise will be there. That's called Turner signs. These are the two signs will be. I mean, these are two signs is for the acute pancreatitis. So know about these things also. Like even pancreatic podocyst, I think we say podocyst, I think. So study about all things from pancreas also is very important. Then liver abscesses, there will be three abscesses will be there, I think. I mean hydrocyst and anaerobes and I mean one more thing will be there. These three topics study from liver abscesses. Then kidney stones also again 10-star question. Kidney stones like various type of stones like triple phosphate and acidic stone and alkaline stones like struvate and stagnant calcification. Many things will be there in kidney stones. So study about variation of stones and how does it appear, like symptoms and signs, and how do you treat size depends on stone size. So study whole thing from kidney stones also. Then urinary tuberculosis is also something important. So also you all know putty kidney, for bladder we say like simple bladder, I think. So for bladder orifice will be there will be like main place, but it's first place to occur TB causes. So these are the important things from the urinary tuberculosis. Then acute appendicitis. Appendicitis is something where 20-star questions. So don't lose appendicitis topic from adult surgery is very important. Then same like hernia also very important like appendicitis. So 20-star question. Then inflammatory bowel disease, definitely you know Crohn's and ulcerative colitis. So study about Crohn's and ulcerative colitis, like the particularly there will be like extra intestine manifestation like UATs and UATs, then will be like something pyoderma aneurysm, arthritis, like many things will be there for apart from causing intestine. So study about that too. Then bladder and urethral injury, definitely this also again 20-star question. Many questions will be come from adult surgery. That's important from surgery. Okay, so bladder and urethral injury, like if we take bladder, there will be extra peritoneal and intraperitoneal injury will be there. If we take urethra, there will be like anterior and posterior urethra will be there, like bulbar and penile urethra will be there. So study about that too. That's very important. BPH is also important. So like everything important from adult surgery. So what I meant 10-star and 20 stars, that's very important from adult surgery, and BPH also is important. So apart from this testicular torsion and priapism, something very important from what I made box from this particular topic, there will be like definitely one question. So easy topics, these are the, I mean, 1 2 3 4 5, these are 5 topics is very easy, but definitely will be forgetting topics also. So study about particularly study about testicular torsion and priapism is two things are very important. So study about this too. Then again, I made again this whole topic at 20th point. So rectal prolapse types will be there, 4 types will be there, and study about types and how you treat that depends on types. So study about that too. Then yeah, again I mean here. Then anal fissure and good salts, I mean anal fistula, good salts rules, very important. There will be like where does its fistula starts, where does is going to end, so depends on site and location. So study about that too. So that's very important. Then anal fissure also something important. So from this four topics, definitely, I mean this from these 4 topics, definitely one question will come for FMG. So again, one question from here and one question from here. So these two things are something important, like end of the adult surgery, but it's quite easy to study and easy for solving question also. Then onco surgery. So onco surgery is 5 topics, very important: breast and thyroid, testicle and prostate. Then pancreatic surgery. So if you ask me more important from onco, definitely these two and prostate. These three are very important. Don't lose single word from these 4 topics. It's very important how you're managing, what is the tumor staging, like TNM, like tumor, lymph node, and metastasis, particularly from breast surgery, and how we are taking care of radiological image, and how we're managing like a simple mastectomy, radical mastectomy, genital biopsy. So after breast surgery, how we're managing with breast, like with which liquid, like silicone, with silicone we're making breast tagging, like I think breast implant surgery or what, I don't know, but study about these things also. Then blood tumor, kidney tumor, these two are you will study in pathology also. Then stomach cancer, particularly you'll say GIST, gastrointestinal tumor. So gist also something important. This thing, what I meant, extra point here. So this will be studied in pathology. So I said I told in main video also, pathology is something is very important for all 19 subjects. So study first pathology. Make sure you are is more strong enough in the pathology. So if we study pathology, whole pathology, then that will be helpful for every subject. So gist is important. Then family adenomatous polyps and colorectal cancer. As you all know, apple core appearance in what colorectal cancer radiological image. So study about these things also. These are the onco surgery important topics. Then vascular surgery from definitely 2 to 3 questions will come from vascular surgery. So particularly if you take intermediate qualification, boys grading will be there, and ankle brachial pressure index will be there, and Fontaine's classification and treatment. This from this 4, definitely one question will become the
like grading or ABPI. So I mean ankle brachial pressure index. Definitely, it's more important from vascular surgery. Study about this too. Then watch disease and thromboangiopathy, obliterations is something important. So study about these things, and I can't explain everything in this video, so I'll make, if you ask me in the comment, I'll make explanation for every topic from surgery. I mean, I'll try to teach surgery in, I mean, upcoming videos. So if you want the explanation, drop leave a message in comments. I'll take another video then. So Raynaud's, I mean, Raynaud's pyramid, it is known as Raynaud's pyramid. So Raynaud's disease, Raynaud's pentad, I don't know exact name. So Raynaud's disease is very very important. So like there will be like three color, I think, white and pink and blue will be there. So there will be two types, 1 and 2. So something you'll make more mistake here. So more commonly, first type doesn't have any comorbidities. So 2 only having comorbidities like sarcoidosis, rheumatoid arthritis, like many other diseases also. So make sure you're strong enough conceptually from Raynaud's disease. So then aneurysm, abdominal aortic aneurysm is very very important. So there will be like 3 types according to something classification will be there. So I'll share this details everything in my Telegram group, so you can find over there the I mean that's these types, slides, everything. So I'll share in my Telegram. Then varicose vein something 10-star questions. Study about everything from varicose vein. Then DVT, without DVT question no exam paper will be complete. So study about DVT also, deep vein thrombosis. Okay, then endocrine surgery, definitely thyroid surgery complication, and from thyroid endocrine surgery. So study about complication of thyroid surgery, and I'll write complication surgery. Then from breast, these 5 topics, definitely 2 questions will be there. Ascites and ductitis is very very important topics. Apart from this, fibroadenoma also is very very important here. Then yeah, that's it. Then salivary gland, if you ask me, salivary gland, ranula and sialolithiasis sorry. Then pleomorphic adenoma is something very very important. Julie paper also they ask this thing. So pleomorphic adenoma also something important. Then miscellaneous, don't lose any miscellaneous topic from surgery. So it will be helpful in dermatology and some other subjects also. So if you ask me miscellaneous, I mark down post-operative complication like ligature, slippery ligature, like bleeding. If you take example of thyroid surgery, there will be like reactionary bleeding at the operation theater, and after that is reactionary. Second will be like within 24 hours, there will be like primary, and third will be after 3 to 4 weeks secondary, if I'm not wrong. These are the concept for the post-operative complication, hemorrhagic. Then keloid hypertrophic scar is, as you all know, is something important. Like every exam they will ask keloid or hypertrophic scar. So sebaceous cyst, so in scrotum there will be like cyst will be there, many cyst, small kind of cyst will be there. So see about that image. What I meant here, these all are the image based questions. So pyodermal gangrenosum, as I told you before, in adult surgery important topics. So pyodermal gangrenosum is something important. Then erysipelas, cellulitis, or necrotic fasciitis. So Google it for the search image from Google, this necrotizing fasciitis. So something is important from this particular topic. So these are the surgery important topics. So thanks for watching.